Hi, and welcome to the Week 12 lecture. This week we'll go over some final test-taking strategies that you can use when taking NCLEX style exams. We'll also look at some specific item types for the NCLEX, such as bow ties, NCLEX questions that include trends, and unfolding case studies. So the first tip we want to talk about is looking for closed-ended words. They include words like all, always, cannot, every, must, never, none, not, only, and will not. These closed-ended words, when you see those in answer options, it means that the answer option is likely incorrect. Of course, never going to be 100% one way or the other, but likely incorrect. So things such as eat foods that have less than 1% fat only. That would be a clue, that word only in there, that's probably not the correct answer. Drink fluids only if they're fat-free. So be looking for these words, and there be red flags that likely it's not the right answer. Open-ended words that you'd want to flag as potentially a right answer include answer options that have the words generally, may, possibly, and usually. Sometimes answer options are medical, and other times they're more related to nursing. So focus on nursing interventions rather than medical interventions when looking at answer options. The only time we would bring in medical interventions is a situation where the question is asking what intervention does the nurse anticipate to be prescribed, or something about how are you going to help prepare the physician, maybe having supplies next to the bedside related to whatever emergency interventions needed. So it might ask, do you recognize what's going on and what the medical provider is going to be doing? But other than that, usually you're going to stick with nursing interventions. You want to eliminate comparable or alike answer options. For multiple choice question, there's only one answer. So if two answer options are similar, likely neither of those answer options are going to be correct. For example, if you have a question and the answer options, you have more than one answer option related to fluid overload, such as you're going to get your patient's weight, another answer option is you're going to monitor the patient's eyes and nose. A third one's going to be that you're going to listen to the patient's lung sounds, listening for crackles if they have too much fluid. Since all three of those answer options are alike, you would likely choose whatever's remaining, right? Because I'm not going to pick weight because I'm concerned with fluid overload, but not the INO and not the lung sounds. So eliminate those like options. On the flip side, sometimes you'll get a question and it'll have opposites. So like answer option A is high blood pressure, answer option B is low blood pressure. When they're opposites like that, usually one or the other is correct. They're not great NCLEX questions, so you probably won't see them on the NCLEX, but that doesn't mean that on a unit exam you might see something like that. So keep that in mind. If you see opposites, likely one or the other is correct. It could be, high potassium is A and B is low potassium. It's probably one or the other. Make sure when reading your answer options that all parts of the option are correct. If the answer option contains two parts separated by the word and, make sure both parts are correct. Quick study tip: when you are studying, use the internet to look up images, animations, videos related to the content being studied. Sometimes those visual or auditory reinforcement is something that's going to stick with you and help you understand a concept better. So you got a lot of resources at your fingertips. Be sure to use those when you're studying. Look for umbrella options. The umbrella option is an answer option that can incorporate some of the other answer options. An example would be a correct answer or an umbrella option: call the nursing supervisor to activate an agency disaster plan. Other options that would fall under that umbrella that could be listed are supply the trauma room with the things you're going to need, call the ICU to request more nurses, call laundry to make sure you have blankets. But that call the nursing supervisor to activate a disaster plan is going to incorporate all of the other answer options, making it the correct answer but since it's incorporating those other answer options, it's known as an umbrella option. You want to recognize normal lab values. Now the NCLEX, you guys are lucky you're testing at a time when the NCLEX is going to provide you with normal lab values. I will say that's not always the case for every nursing exam in nursing school. For example, I have certain labs that I require nursing students to know so that when you graduate, you know the basic things that you need to have memorized, even though the NCLEX might provide you with them. So you want to be able to recognize any normal lab values that your lecture instructor or your clinical instructor has told you is important, need to know lab values. And when you're getting questions related to lab values, look, see what the health problem is being addressed in the question. Identify if there's a specific organ being addressed, because some lab values go with specific organs, such as ALT and AST with the liver, amylase and lipase with the pancreas, and identify whether the lab value is normal or abnormal. And what does a high value mean? What does a low value mean? If my liver is not working properly, would I expect those liver enzymes to be high or low? Those are things you'll want to know. Visualize the information. It can be useful because you create a mental image. You may recall a similar situation that you experienced in an actual clinical setting. That's always great learning when something in clinical reinforces what you've learned. I know the signs and symptoms of hyponatremia because I can vividly remember when I cared for a patient with hyponatremia. So those types of things can help. Look for concepts in the question that are like concepts in the answer option. Read the question carefully, noting any strategic words and the subject of the question. And as you read the options, look for one that contains comparable or alike concepts or has a relationship to those identified in the question. The textbook has some information regarding client positioning, which I'm not going to read through, but it's helpful. So definitely, you've done your reading. I'd make note of that section. And then when you learn about specific conditions, if there's a specific position that's preferred for that condition, it should be in additional readings that you're doing, as well as lecture and practice questions. Same with diet. I'm not going to go over specific diet information, but we will address diet in relation to culture and diet in relation to different diseases. And that's something that you'll tackle as you progress through the program. So you will be learning about nutritions and diets for sure. And lastly, I'm not going to go into questions related about disaster. That's a concept that you're going to become familiar with in Adult Health 2. So we'll wait and address it then in Adult Health 2. I am going to show you a couple item types for the NCLEX. This one here is called the bow tie. And what it is you have a scenario usually, and then you have 5 answer options to put in here. So usually it describes something and you have to pick what condition is being described here. That goes in the middle of your bow tie. Then you pick 2 actions to take and 2 parameters to monitor. My tip for you with bow tie questions, likely probably not going to see them in your first year of nursing school, but I will use them in second year, is once you pick and commit to a condition, forget the scenario that was presented and now consider it a question just about that condition. Sometimes students you start concentrating on something that was in the scenario and pick something, action to take or parameter to monitor based on the scenario, but it's all related to the condition. So once you pick the condition, forget about the scenario and answer according to the condition that you picked. We want to watch for trends in our NCLEX style questions. And that means it's not just a snapshot of what's happening. I look at the labs right now and this is what they're saying, but it's giving me data over hours or even over days. And that's called trends. So I can see if blood pressure is going up and down, what the temperature is doing, how the labs are changing. And that gives us information if my patient's stable, not changing, getting better, or getting worse. So if you get an NCLEX style question and it's over hours or over days, it's telling you this is a trend question. And what you're really looking at is my patient getting better or getting worse? Do they have like a new complication related to a medication that might be showing up? So it's usually you're looking for changes and interpreting the changes in those trend questions. So when you have a trend question, let's say it says your patient got admitted with heart failure. And then when you get to the answers, don't automatically default to heart failure, because the trend might be showing a complication related to medication. We want to be able to tell whether your patient's improving or declining, all that good stuff. So it's really these big picture type questions that you have to interpret how the patient's condition is changing and what might be causing that change. Then the last item type we're going to look at here is the unfolding case study. So that is unfolding, so it's not just a snapshot. It'll be a client situation over time, minutes, hours, or days. And you'll have 6 questions associated with that unfolding case study. And they'll address the NCSBN clinical judgment action model. So you'll have a question about recognizing cues, analyzing cues, all the way up to evaluating outcomes. So 6-part question related to case studies.